Okay,
So
ma'am.
here is your station. Would you be able to do it now? Yes, I hope so.
Okay, ma'am, I'm ready.
Yes. Are you also ready?
Yes, inshallah.
Okay, right. So we'll begin. So if you've read and understood, considering it communication skills station, please begin.
Hello, I am Dr. Mahmood, one of the surgical doctor. Can I confirm that I am talking to mother of X?
Yes, doctor. It's me.
Yes, ma'am. So, what is your concern?
I have been told that my son came to the hospital and he's in the operating room. I don't know what is the problem exactly.
I'm so sorry, ma'am. I apologize that we couldn't contact you before because your son came in a critical condition. So his father brought your child here to the emergency, then with some bruise over the left side of his tummy and severe pain. We did an scan which shows some bleeding inside. So we suspect that he might have a ruptured spleen. So let me tell you what is the spleen is a organ which is situated on the left upper side of our tummy. So this is a critical condition. The patient was bleeding inside his tummy, so we had to take him to the theater as early as possible to operate and to fix that spleen. So that's why I couldn't contact you before.
To the theater, he is in the in operation now.
Yes, ma'am, he's under the operation now. So our most experienced and skilled surgeon is operating him right now.
Is it serious, doctor?
Yes, ma'am. It was very serious condition. So it was bleeding inside his tummy. So it was like can endanger his life. So to save his life, that's why we had to take him to theater.
Said it's serious. Oh no, he's just a little boy. Doctor, but you told me who brought him to the hospital.
Uh, okay, I'm sorry again. Yes, his father brought a child. So according to his father, that he was playing outside and he fell from a tree, and then he was shouting, and then he came out and he found that he has severe pain and some bruise on left side of his tummy.
How come, doctor? For his father is not here. He's not. His father is working. He's not his father.
Okay, I'm so sorry. I didn't know that. But he said he's his father, and then the patient was in an emergency condition. Then we had no other choice. We have taken consent from his father.
Okay, you want to take consent?
We had to take consent from his father because it was an emergency operation. So we had to take consent from him for the operation.
Okay, but his
And
father.
I apologize again that we couldn't contact you before because it was a very emergency condition.
Okay, I understand, Dr. Members. But about the spleen that you mentioned before, is it important, Doctor?
Okay, it's an important organ. It gives or it helps in immunity of a person. So some encapsulated bacteria can infect a person without that one. So as we had to remove it, then we have to give the child a vaccine for those encapsulated bacteria, and we have to give long time antibiotics.
Yeah, Doctor, can I go and see him now?
No, you can't go inside because the surgeons are operating now. So please, we cannot allow you to go there to interrupt the operation. But as
Okay.
soon as he is out of the theater, then I will allow you to meet him.
Okay, for how long they will stay in the theater, in the operation room?
I'm not very sure, but of course, it's an emergency operation, so they will take some time.
Okay.
But as long as it's done, then I will let you know.
Okay, Doctor. When can I take him, and when we can go home?
Okay, so after the operation, we'll take care of him post-operatively, and when we'll feel that the patient is out of danger and he is recovering well, then only we'll discharge the patient.
Okay, Doctor. Thank you. Thank you, Doctor.
Okay, you
Okay.
can maybe discuss
Okay, so let's summarize, ma'am,
first
what we have
about the
gone through.
home situation and
I
child.
will ask him. I will ask
Okay,
him.
okay.
Dr. Mahmoud, I am the mother of the child.
Yes, please
Uh,
continue.
okay, you said the spleen is okay. What happened if you remove the spleen and there's a bacteria? Maybe he will die. What you will do?
No, we will put him on vaccine for those encapsulated bacteria. There are several bacteria, so we have to give vaccine against those bacteria, and he has to take a long time antibiotic to prevent infection from those kind of bacteria. So it could be like more than 2 years.
You said how long you will give him antibiotic?
It's more than 2 years.
More than
And
2 years.
in some cases, even up to 16 years of his age.
I am afraid he will not retain a normal child.
He will continue his life as a normal child if he recover well. Of course, still after the operation, his life is still under danger, but we'll try to manage the patient and we'll make sure when he has a good recovery, then we'll discharge the child. And
Okay,
then
but
he can be a
Dr.
normal
Mahmoud,
child.
Dr. Mahmoud, how you take my child and the father is drunk? How you take the consent from him and he is drunk?
Okay,
He's every day drink alcohol, everything. How
Okay,
you
I'm
take
so
the
sorry
consent?
to hear that. Of course, the patient was in a very critical and emergency condition, so we had to take consent from him. There was no other choice to save the life of the child. And in that case, as you mentioned, he is drunk regularly. So I will inform the child protection team, and then I will make sure that your child is in a safe hand.
Okay, you will remove the spleen?
Yes, we had to remove the spleen as is already ruptured.
Okay,
So
you
if
cannot
we
repair
don't
it?
remove
You
it,
cannot
uh,
you cannot
no, if
repair
we
it?
don't remove it, it will cause more bleeding inside his tummy. So we had to remove it.
Okay, what any advice for his lifestyle after removal? What I should do for him?
Okay, so if he has a good recovery and if he take vaccine and antibiotic properly, then he might not need to change anything special.
He can go to sport or and playing
Yes,
football like this.
after like some months when he completely recovered, then he can go for his sports and everything.
Okay, okay. Thank
Good.
you. You will summarize now.
Yes.
Okay,
Summarize.
so let me summarize what we have gone through. So your son came as a very critical and emergency condition with severe pain and a bruise on on his left side of the tummy. So we did a scan, and it shows his spleen was ruptured. And I explained you what is the spleen and what is its function, and then what could be the complication and what we have to give to protect from the encapsulated bacterial infection. And I already explained you that is a very severe condition, and of course it might endanger his life, and we have to have follow up his good recovery. Then we will discharge the patient.
Okay,
So are
good.
you satisfied now?
And at the end, if
And
satisfied, yes, I will
uh,
consent.
okay. And
Okay,
after
I
that,
will.
as you mentioned about his father's condition, so I will inform the child protection service, and then we'll make sure that your child is in a good and safe hand.
Good.
Thank you. If you have any query, I will leave my number to the nurse. You can don't hesitate to call me and ask a question.
Okay.
Right. Thank you.